Welcome to another episode of the MEGIN Spotlight series. Today, we are delighted to welcome Amy Godknecht. We were introduced to Amy by our previous Spotlight guest, Dr. Salim Malik. Amy has kindly agreed to share her experience as a mother to a daughter with epilepsy with us on the Spotlight today. Hi, Amy.
Hello.
Can you provide an introduction to your daughter's epilepsy journey? How old was she when diagnosed, and what type of epilepsy does she have?
Sure. Autumn was diagnosed in 2006 when she was 3 years old. She was technically diagnosed with focal refractory epilepsy caused by cortical dysplasia.
So at what stage did you realize that you may need to pursue epilepsy surgery for your daughter?
Autumn tried and failed numerous medications. We probably gave it about 4 years, which is a long time. It was from about 2006 to 2010 that we really tried to get it controlled with medication. And there were times that the medication controlled it well, and we would get a little bit of stability. And then just as the years progressed, we really decided that for quality of life, Autumn needed to pursue, other options. So that's when we went in for our first surgical evaluation was 2010.
Thank you for sharing that part of your epilepsy journey and kind of process to getting to realizing you might need to pursue epilepsy surgery. So in our previous call, you said that your daughter has undergone multiple brain surgeries for epilepsy. At what point in your daughter's epilepsy journey were you introduced to MEG? How has this modality helped to inform the clinical decision-making process over these surgeries?
Sure. Autumn, when she first went in for a surgical evaluation in 2010, our hospital did not have the MEGIN machine. So we had to go forward with her first resection without having that data or information. We did a SPECT scan and we had MRIs that we were able to use. And then she had to go in and put the grid actually on the brain at the time because we did not have the MEG scan data. And then as the years progressed and puberty entered the picture, we quickly realized that the seizures were just not as controlled as we wanted them to be. And in 2017, Cook Children's, where we went in Fort Worth, Texas, had the machine. And our doctor explained to us how much data they could get from the scans. And we were excited because when you're a parent, the first thing that makes you nervous about a brain surgery is we do not want to mess with any part of the brain that is in control of movement, language, speech. So you want some reassurance that that's not any of the areas that we're, going to be messing with. So we were excited that the machine was there, and that's when we chose to pursue more surgeries since we could gather more accurate data.
Thank you for sharing that, and also kind of the impact of MEG becoming part of the process later on. So what was your daughter's experience of having an MEG scan compared to other imaging modalities?
Well, the MEG was non-invasive, so really all Autumn had to do was lie still while they collected what they needed to get. They asked her some questions, and at one point she needed to fall asleep. Her seizures happen mostly while she's sleeping, so they wanted to have an accurate picture of that. So it wasn't anything harder than what she'd already done, lying still for an MRI. So our hospital also has child life specialists that if you have trouble while you're in there, or, the children get nervous or have any anxiety about it, they can come in, and they're very good about giving them breaks and, giving them time to sort of get used to the process. But it wasn't anything different than what she had already done with MRIs and other scans that she'd had.
So how is your daughter doing today following her latest brain surgery?
She's actually doing really well. She is several months seizure free, and she has plans to go to college in the fall. So everyone's excited about that. Just making sure we have a seizure plan in place, and making sure that she's as safe as possible, but moving on to the next stage of her life where she gets to gain some independence. And that's really what these surgeries have been all about, is trying to get her the quality of life where she can do the most, get the most out of her life. And we're excited that we're getting to move on to that next stage.
That's very exciting. So we understand that you are now looking to transition from a pediatric epilepsy care team to an adult team. How are you selecting a care team for your daughter? Do you have any criteria or must-haves for this new team that could be helpful for our audience to hear too?
That's a really great question. It's hard when your child has seizures from a very young age. It's been sort of us as a team. Autumn is the one with epilepsy, but we're very much part of the caregiving and the decision making. But now we're transitioning. She's 20, so we are having to transition to, this is Autumn's journey, and she needs to feel comfortable with the doctor. And coming from a children's hospital that is so good at what they do, we had some big shoes to fill when it comes to the adult part of where we want to send her. So when we're looking for places and thinking about doctors, one big factor was we would want them to be an epileptologist versus just a neurologist. Autumn's epilepsy is complicated, so we've noticed along the way that we've been introduced to neurologists and epileptologists, and it's that extra specialty in epilepsy that's made a lot of difference for Autumn. So that's one thing that we've wanted to make sure. And then also just knowing what's available as far as imaging and the latest technology. We don't want to feel like we're moving backwards in any way. We want to make sure that we have the same access to the types of testing that we were able to get at the children's hospital. So those are the two big things, is just making sure we're sort of moving forward with the technology and the expertise that can help Autumn in the next phase of her epilepsy.
I really appreciate you saying that, because I think your criteria will be helpful for other parents and patients to hear that are also navigating a similar transition in care teams, or maybe even selecting a care team for the first time. So thank you. Are there any epilepsy groups or institutions that you are involved with that you'd like our audience to have the opportunity to learn more about?
Yes, we've been involved with the Epilepsy Foundation. Specifically for Texas, we do the Texas chapter, so Epilepsy Foundation of Texas. Autumn has gone to some of their summer camps where the doctors from our hospital actually go and help participate. And that way, that when you're sending your kid to camp, there's experts there and healthcare providers that they were able to give her an experience that maybe she wouldn't have been able to have at just, a regular camp. Either she wouldn't have been able to go because the people there couldn't handle, the seizure aspect. So that's been nice. They offer camps, and then they do a lot of fundraising to be able to help have clinics. And we've been involved in the fundraising. They do a big, walk every year at different zoos around major cities in Texas, and that's always a good time. So the Epilepsy Foundation is probably the biggest one that we've been involved with.
And finally, what is one piece of advice that you would give to parents who are caring for children with difficult to control epilepsy?
As far as advice goes, I think there are two big things that I would give another parent or family that is beginning their epilepsy journey. One is make sure that you take the time to take care of yourself, because it can be very consuming to focus on, your child. And, we have another child also. So, making sure that we take the time to sort of reset and have respite from always focusing on just the epilepsy and the seizures. That's been important to our family. And then my second piece of advice would be, it's very easy to sort of just want to pause life because the seizures can sometimes feel like they take over. But we feel like we've done a pretty good job of, we want Autumn to be safe, but we still want her to live life. So we've made a lot of adjustments and sort of always have a plan B, but we've really tried to move forward with vacations and traveling. And maybe we haven't been able to always go, it hasn't always looked exactly how we wanted it to look necessarily, because we want to make sure we're, close to hospitals, or do we need to have, um, access to make sure, we're not in the middle of nowhere or whatever. But we've really made sure that even if she couldn't be involved in what everybody else was involved with because of any sort of restrictions with her epilepsy, okay, what can she do? So I think that's important, because it can feel like, you just want to keep them safe and not necessarily have them do normal things, but that's important for them to feel like they're getting to live life also. So it's it's a little tricky to do in the beginning, but as long as you just kind of have a contingency plan, I think that it's very important to just sort of keep moving forward with life and have things to look forward to that's not always about seizures and testing and epilepsy.
Thank you so much. It has been an honor to speak with you today. This has been extremely informative for our audience, and thank you again for sharing your story with us.